Patient information. Mr. Albert Schwargen is a 73-year-old man who is a widower. His spouse passed away 9 years ago. He was admitted to the hospital on September 3, 2010, and was discharged on September 7, 2010. Diagnosis. He had surgery to replace his left hip joint, total hip replacement. He has high blood pressure, which has been an ongoing health concern. Social background. Mr. Schwargen has been living in the Greyhound nursing home for the past 4 years. He doesn't have any children. He used to work as a radio engineer until he retired at age 65 and is now a pensioner. His hobbies include playing chess and operating ham radios. His sister, Dawn Mason, who is 66 years old, visits him regularly and is very supportive. They play chess together during her visits. There are no signs of dementia or memory problems observed in Mr. Schwargen. Medical background. In 2008, he had a condition called osteoarthritis in his hip, which required surgery to replace the hip joint. Since 1989, he has had high blood pressure, and he's been taking medication to manage it. In 1985, he had a broken wrist, which was treated with surgery, ORIF. Medications. He takes aspirin every morning, 100 milligrams, since his recent surgery. He also takes ramipril, 5 milligrams, every morning for his high blood pressure. For pain relief, he takes Panadine Forte, Cocodamol, 2 tablets, up to 4 times a day as needed. Nursing management and progress. Mr. Schwargen's surgical incision site on his hip requires daily dressing changes. He's doing exercises to improve the movement and strength in his hip. He's receiving occupational therapy to help with daily activities. In 2 weeks, on September 21st, the staples from his surgery will be removed. He needs to have follow-up blood tests at the City Hospital Clinic. Assessment. After the hip surgery, he can walk with the help of a walker and can move around the hospital ward without much trouble. He experienced some confusion about time and place after the surgery, probably due to the anesthesia. They suggest keeping an eye on this. His blood level dropped after surgery, but it stabilized before he was discharged. However, they will continue to monitor him for anemia, a condition where the blood doesn't have enough red cells. Discharge plan. He needs careful monitoring of his medications, especially Panadine Forte for pain relief. His skin needs to be protected to avoid any damage. He should continue with his exercise program. The hospital will provide him with a walker to assist with mobility at the nursing home. I hope this simplified explanation helps you better understand Mr. Schwargen's medical situation and care plan. Dear Ms. Helen, I trust this letter finds you in good health. I am writing to provide you with essential information regarding the care of our patient, Mr. Albert Schwargen, who will be transitioning to Greyhound Nursing Home for his continued care following a recent hospital stay. Mr. Schwargen, a 73-year-old widower, was admitted to our hospital on September 3, 2010, for a left total hip replacement (THR) procedure. His surgery went well, and he has been making good progress in his mobility post-operation. He is currently weight-bearing with the assistance of a wheelie walker and can walk the length of the ward without difficulty. However, during the early stages of his recovery, he experienced some disorientation concerning time and place, likely related to the effects of anesthesia. Thus, I recommend continued observation in this regard. His medical history includes diagnosis of hypertension, which requires ongoing management with ramipril 5 milligrams once daily. Additionally, he takes aspirin 100 milligrams daily and Panadine Forte, Cocodamol, 2 tablets 4 times a day as needed for pain management. His HB levels dropped post-operatively, requiring a transfusion of 3 units of packed red blood cells, but his HB stabilized at 112 on discharge, necessitating ongoing monitoring for anemia. As part of his care plan, Mr. Schwargen will require daily dressings at the surgery incision site, range of motion exercises, and occupational therapy. Staples will be removed on September 21st, and he has follow-up tests scheduled at City Hospital Clinic. We kindly request your support in monitoring his medications, preserving skin integrity, and ensuring the continuation of his exercise program. The hospital will provide a wheelie walker as part of his discharge plan. Thank you for your dedication to patient care, and please feel free to contact me if you require any further information or assistance in coordinating Mr. Schwarzen's care. Sincerely,